So in this video, we're going to be looking at lower extremity training right now. And we're going to be looking specifically at the sit stand, also known as the squat and the hip hinge. When we look at these two exercises of the squat and the hinge, I want to reduce the amount of things that you're looking at. And so we're going to be looking at 6 things, and they're all going to be related to each other, except for maybe number 6, the bar placement. But we're going to look at the feet, the knees, the hips, the pelvis, and the spine. And so when we look at this lower extremity, look at a squat, we're going to look at the foot placement, make sure the knees are tracking. We want to make sure that we're in lumbopelvic neutral. We're not doing this butt wink. And then we'll look at the hinge as well and making sure we're doing appropriate aspect. The first things first is that I had mentioned in class that there is no variation of the lower extremity sit stand, which is, I guess, not true, because you can do unilateral, like the guy on the right doing a lunge. You can do bilateral squat. You can vary it in terms of doing like a pistol squat, like the gal on the left, or doing leg press. But all of these have something in common, is that it's some level of triple extension. You are doing hip extension, knee extension, ankle extension to go from change your body in space, going from sit to stand or elevation. You can manipulate the plane that you're in. You can go wide stance or close stance, and you can favor more the frontal plane versus the sagittal plane. What we're going to talk about first is this quad dominant versus hip dominant, looking at the moment arm that exists between the knee or the hip. And the biggest thing that you're going to see here between the quad dominant and the hip dominant is how much forward translation you get with the knee. So I do want to point out that in both of these movements, foot is flat on the ground, and that is probably the number one thing. And then you can see that the back is straight in either of these, but all that's happening is, did he shift more of his weight back to the hips to minimize the moment at the knee, or did he allow his knees to come forward and he put more of a responsibility through that knee? But you can see that his shoulder, or the weight that would be right through the back of his head, is coming right through the middle of his foot. And same thing here, it's coming maybe a little forward, but he's got his shins maybe perpendicular. One is not better than the other. They're both good exercises, and they both have variations that are appropriate. Here is a more obvious aspect of a hinge versus squat, more hip dominant versus knee dominant. You can see, again, the near perpendicular, so 90 degrees between the floor and the shin, whereas here he's allowing a 60 degree or so more translation. There's a myth in the fitness industry that it's inappropriate to allow your knees to go over the toes, and that is not true. Nothing's going to happen in that. What ends up happening, though, sometimes people don't have the ankle dorsiflexion. If their knees go over their toes, that means their heel came up, and that means that their foot's no longer making contact. So that's the most important aspect, is the contact. But that's the main difference between the hip dominant and knee dominant, is how perpendicular are keeping your shins. And so you can see that the knees they're not going forward, they're actually staying here. They might creep a little bit, but you can see that the hips have gone straight back. Whereas in a knee dominant, you allow more of that anterior translation, and thus the hips follow and they're not as far back. You can see the progression, squat on top, hip at the bottom here, and you can see the hip versus knee dominant. This low bar back squat is the most hip dominant you can do, and you can kind of see here, you can see that as the load changes, as the load goes from back to front, that the torso gets more upright and the knees go forward. So it might not look so different in these, but this subtle type of loading, particularly the fact that you have an overhead squat and this balance aspect, but you can see that where the load's at. With the Romanian deadlift versus conventional versus sumo, you can see also too the torso is changing, whereas the torso is pretty much parallel to the ground. And as you change your foot placement and you kind of change the way that you have where your bar has to clear the knees, you can change your torso or your angle. So now, regardless if you're looking at the squat or the deadlift, your foot placement is key. And the first thing, which is not depicted in this slide, is foot is flat on the ground. That is the most important aspect. But what's going to happen is, depending upon the width that you pick, if you're going to go narrow stance or wide stance, that you can see that the wider your stance goes, the more of a flare your feet have to take. So what you don't want to do is have a really wide stance and have your feet straight ahead, because now you're putting these weird forces through your ankle, and you don't want to be standing with your feet close together and then your feet turned out like in a pirouette. So if you look at like a 180 degrees on the ground, If you have about a shoulder width stance, you should be at about 30 degrees or so. And that the wider you go, the more your toes are angling out. But you can see that at any given point, you're making a V. And if you were purely in the sagittal plane, your legs were together, your feet would be right next to each other, parallel to each other. And if you went as wide as you could, like a sumo style, your feet are pointing way out in this direction. The next thing you're going to look is, after the foot is flat, is what's happening at the ankle. And you want to make sure you're avoiding this position here. You can see this guy's heels popping up. Sometimes you can't avoid that because of the lack of flexibility. So great, put some support under the foot. The new plates with the rubber plates on them, they are a little thick, but you don't need this much. Probably you can get away with like half an inch or so. I had said this earlier that you can see in this guy, his knees are way over his toes. Look at, he's got about, like half of his whole foot there. But his foot, he's coming forward a little bit, but his foot's relatively flat. This is not a bad position. This guy's got long tibia, long shanks, and everyone's going to have different aspect. The people that can squat and keep their knees over their toes, they have long frickin' femurs and short tibias. This guy, he's got long tibias and short femurs. He needs to, in order to have appropriate squat, needs to have his knees travel over his toes. Now, he probably won't be able to get down any lower, and so he's not a candidate for the sport of powerlifting, but that's okay. The next thing you're going to look is this knee. You're going to look at the knees and see what's happening. And what you don't want to see is any of this knee diving in aspect. And what's happening in this aspect is the load's too heavy and the knee is collapsing with gravity. Repetitively over time, that can be an issue. And I think this is a setup photo. He might be doing this, I don't know. But that is a LCL or MCL injury waiting to happen right there. So basically, wherever the toes are pointed, the knees should be following. So you can see in this position, this guy's feet are pointed out and the knees are diving in. So think of it like the toes are setting the course for where the knees need to operate. You can see here, the toes are right in a line here, they're diving in. So you can kind of see that this angle here, everything should be in appropriate alignment. So as we move up, we start to get into the lumbospinal complex here, and the spine should be making the torso should be making 3 points of contact. So the back of the head, the shoulder blades, and the tailbone. And so that's when people say you're supposed to keep your spine straight, this is what they're talking about. You can see when she's in this bottom position here, she's able to keep a relatively good position, but then right there, depending upon how low she's going, she's starting to wink a little bit under the aspect. And you can see that kind of depicted here. You can see hyperlordosis. He's trying to do too much torso extension. And here he's got it just right in terms of that lumbo-neutral. So this is what you want to see, spine straight. This is what you don't want to see, this rounding of the back. So you're getting this posterior pelvic tilt. So that his tucking, if he had a tail right here, his tail would be down and relaxed, no problem. Here, he's a dog that just got in trouble. He's got his tail tucked under between his legs and he's rounded through the back. In a non-loaded squat like this is perfectly fine. This is great, actually. Like if you look at a children's squat or you look at primitive, or when they squat, they're not loaded through the spine. This is okay. It's when you're putting load or explosive loads through the back that becomes an issue, and then this becomes ideal. So you should be able to get this relatively neutral back without having to go into this position. If this is happening, there could be some length issues in the hamstring, usually hip flexor weakness or shortening, and some ankle dorsiflexion issue. So again, you can kind of see here, you can see the spine relatively straight, and the big difference between the right and the left here, you can see it curved, is this thing called a butt wink. But basically what's happening is the spine is not doing this at all. This is the pelvis. This is the pelvis rolled back. So she's got a tail and she's lifting her tail up, and here she's tucking her tail underneath. Some people have the ability to control it. A lot of people don't. They have to learn, or they have some mechanical resource that's limiting them. But this right here, correcting this pelvic positioning, is where you're going to spend 90% of your time as a movement specialist. So again, the hinge versus the squat, when we look at hip dominant versus knee dominant, we went through everything here from foot placement to shin to knee to hip to back. And now we're going to talk about loading a little bit. Look at these two positions here. What is different? You can see clearly that he's flatter in the back, and here, both he's straight, so I don't think there's anything wrong with the spine. But the big difference here is that he's hip dominant here, knee dominant here. And you can see where the load line's at. The load's still starting between his feet. But in this position, he let his knees go forward more so he can be more upright. In this position, he kept his shins perpendicular, so he needed to stick his butt back more to do that. So when you teach someone how to do a hinge versus a squat, the main difference is you're going to prevent this knee from going forward. You're going to want 20-degree bend in the knee, but really what that's doing is putting tension on the hip. Your quadricep muscles, your glutes, 50% of them don't attach into the bone. They attach into the through the fascia of the leg, and it's dependent upon muscle tension in the quads. So in order for the glute to be able to maximally contract, you need about 20 degrees of knee flexion in order to get tension through the quads to make sure the glute can fully activate. So you don't want to do this, you want to do this. If you measure the angle there, that's 20 degrees. That's also 20 degrees, but what he did here in this position, he got 20 degrees of knee flexion by pushing his butt straight back, like here. In this position, he got 20 degrees in knee flexion by letting his knees go forward. Now, this is appropriate if you're doing a squat, but if you're doing a hip hinge, this is not what you want to do. In a hip hinge, you should put a bench right here and your knees won't move at all. The only way this is happening is because your hips are going back and you're hinging at the hip. Hip hinge is a hip dominant exercise. Okay, so that's the big difference is when you're squatting, your knees go forward, feet stay flat. When you're hinging, your knees aren't moving. Your hips going straight back. And just like this, right? You can see perpendicular, straight up and down. No problem. Perpendicular, straight up and down. Perpendicular, straight up and down. This is a good squat. This is a good deadlift. This is a start of a squat. This is a perfect hip hinge. This is a perfect hip hinge. This is knees are coming forward a little bit, but I think in this situation, the weight is too light. If you think of a deadlift, think of it as dead weight. That's what's happening is the weight's just pulling straight down, just hanging there, waiting for you to do something. So don't try to control it. Just let the weight hang. But again, the hip hinge, he's got good spinal position, good tucking here. Deadlift progressions, you can manipulate the pulling height. So we have these DC blocks in the gym, or you can put them on plates. You can just do practice hip hinge with body weight only. I think dumbbells or kettlebells in between the legs is a great starting point. And then to make it more difficult, you can raise yourself up so you have to go deeper in the hole. I probably would not recommend that. And again, here's looking at the hip dominant progression from low bar back squat to high bar back squat to front squat. And I would say this is the most appropriate progression from easy to difficult. And then same thing with deadlift, going from Romanian conventional. These are just these different progressions from hip dominant to knee dominant. And the reason why you want to do more hip dominant is that patients and clients are usually stronger in the hips than they are in the knees. They can learn a squat better with a hip dominant activity than they can with a knee dominant activity. So next couple slides, I just have some variations to see the, now with the trap bar deadlift, you can do whatever the heck you want because your knees are going forward a little bit. If you try to do this type of movement with a barbell, your shins would be all bloody like this. But yeah, here's your deadlift, your conventional deadlift pulling from the floor, which is different than your Romanian deadlift, which is not pulling from the floor and you're not allowing your knees to bend anymore. Basically, the deadlift is a concentric phase of the squat with no eccentric. So you can lift the weight up and then you don't have to worry about it coming back down. So you're starting from the bottom position like you are doing a squat and you're pulling from the floor. Whereas a Romanian deadlift, a hip hinge, you are starting in a standing position, you're bending forward and coming back up, and you may or may not have the weight touch the floor. Not touching the floor, not touching the floor. It's not about touching the floor, it's about keeping appropriate positioning. And you can see again here, they're not even perpendicular, they're kind of going back a little bit. His shins are going back. These are all perfectly executed hip hinges. And that's it for the squat versus hip hinge. So what we'll practice next week is we'll look at squatting techniques and we'll look at the difference between the hip hinge and some of the cueing aspects that we need to do that.